Hello friends, welcome to my new video about the reasoning questions of the cardiovascular system. So let us start. Now why there is a physiological hypertrophy of the left ventricle? So left ventricle has to do more work than right ventricle so that the left ventricle wall becomes thicker than the right ventricle. So there is a physiological hypertrophy of the left ventricle. Heart rate increases in inspiration. Why? So the heart rate that varies with the phases of respiration. It increases during inspiration and decreases during expiration, and this phenomena is known as sinus arrhythmia. Now during inspiration, the impulses in the vagus that from the stretch receptors in the lung that inhibit the cardioinhibitory center in the medulla oblongata. So the tonic vagal discharge that is responsible for the increase and decrease heart rate during inspiration and expiration respectively. Cardiac muscle to function as a functional syncytium. So the gap junction, a specialized intercellular junction, is present in the intercalated disc along the sides of the adjacent myocardial cells. Here the ions, electrical currents and other molecules can be transferred from the one cell to other without coming in contact with the extracellular fluid, and so that they provide a low resistance bridges for the spread of excitation from one muscle fiber to the next muscle fiber and permit the cardiac muscle to function as if it were a functional syncytium. For example, for a single cell. Bradycardia in raised intracranial tension. Now when the intracranial pressure is increased, the blood supply to the vasomotor area is decreased, and this causes local hypoxia and hypercapnia. Vasomotor area is excited to increase the blood pressure, and which can increase the blood supply to vasomotor area. When the blood pressure is increases, there is a reflex reduction in the heart rate. This is the only condition in the body where we have increased blood pressure associated with the decreased heart rate, and that phenomena is known as Cushing reflex. So in this way there is a bradycardia in raised intracranial tension. Intercalated disc help in increasing the force of contraction of cardiac muscle. How? So at the point of contact of the two muscle fiber, extensive folding of the cell membrane occurs, and that is known as intercalated disc, and they provide a strong union between the fibers so that the pull of one contractile unit can be transmitted along its axis to the next, so thereby help in increasing the force of contraction. Tachycardia in old age. Why? So because in the old age there is a fall in the vagal tone, so that there is a tachycardia in old age. Heart sounds are not produced during the opening of the valves. Why? Because the opening of the valve, that is a very slowly developing process, so that they do not produce any sound. Myocardium, that is well perfused during the diastole. Why? So the vessels which are situated within the myocardium, that are compressed during the myocardial contraction. Now during the diastole, the cardiac muscle relaxes and no longer obstructs the blood flow through the left ventricular muscle capillaries, so that the blood flows rapidly during diastole, so that the myocardium is well perfused during the diastole. Dilated heart has to do more work than a non-dilated heart. Now because when the radius of the cardiac chamber is increased, there is a greater tension must be developed in the myocardium to produce any given pressure. So dilated heart has a more radius, so that there is a more tension is developed. So dilated heart has to do more work than non-dilated heart. Thin-walled and delicate capillaries are less prone to rupture. Why? So smaller the radius of the blood vessels, lesser the tension in the wall necessary to balance the distending pressure, so that the thin-walled and delicate capillaries are less prone to rupture. Atrioventricular nodal delay is clinically important. How? So this is important because the atria gets enough time to empty their blood into the ventricles because of the AV nodal delay, and efficiency of the ventricular pumping is increased, and also it prevents the entry of too rapid impulses from atria into ventricles. So clinically the atrioventricular nodal delay is important. During the blood pressure measurements, the systolic blood pressure should be first measured by palpatory method. Why? Now in some patients of the hypertension, there may be a gap in the Korotkov sound. As the mercury is lowered, a few faint sounds are heard and which soon disappear and only to reappear once again at a lower pressure. So this brief interruption, which may range from 40 to 60 millimeter of mercury, that is known as auscultatory or silent gap. If the mercury column is raised to this gap and then the pressure is lowered, one may miss the first appearance of the sound, which indicate the systolic pressure, and thus record a false low systolic pressure. So to avoid this mistake, the blood pressure should always be recorded by the palpatory method first, and then during the auscultatory method the mercury column must be raised 30 to 40 millimeter of mercury above the level found by palpatory method. And if we record the blood pressure only by auscultatory method, the systolic blood pressure may be underestimated due to presence of auscultatory gap, particularly in hypertensive individuals. But during the palpatory method, this gap is not seen. So there will be an idea of actual blood pressure. So the palpatory method is done before the auscultatory method to get an approximate value of systolic blood pressure. Subendocardial portion of the left ventricle is more prone to myocardial infarction. Why? Now the vessels which are situated within the myocardium are compressed during the myocardial contraction, and during the diastole the cardiac muscle relaxes, no longer obstructs the blood flow through the left ventricular muscle capillaries, so that the blood flows rapidly during all of the diastole. Now since the blood pressure between aorta and left ventricle is very small during the systole, and therefore the blood flows to the subendocardial portion of the left ventricle only in the diastole. However, the pressure differences is more in superficial portion of the left ventricle to permit the some flow in this region throughout the cardiac cycle, while the blood flow to the right ventricle and atria that occurs both during systole and diastole, because there is no blood flow during the systole in subendocardial portion of left ventricle, so that this portion of the left ventricle is more prone to myocardial infarction. Now on reaching the atrioventricular node, the speed of the conduction of the impulse is slowed down. Why? So there are a certain causes so that the speed of the conduction of the impulse is slowed down at AV node. So first of all, number of the gap junction, that is very less between successive cells, so that the velocity of the conduction is decreased. Then presence of multiple branching system that are present in AV node. And cells of the atrioventricular node are made up of small diameter fibers in which the velocity of the conduction is less. Atrial and ventricular muscles do not show autorhythmicity. Why? So potential in them, atrial and ventricular muscles, is plateau potential, and it is not spontaneous, and it is produced only by stimulus from the pacemaker cells, and which is spontaneous, so that the atrial and ventricular muscles do not show the autorhythmicity. Thank you for listening to me, and if any questions or any query regarding this topic, please write down in comment section and please give me a feedback. Again, thank you very much.